Have you heard about type 1 and type 2 diabetes? These are health conditions that affect millions of people worldwide, and understanding their differences is crucial for treatment and prevention. In the current world where health has become a topic of great importance, it's essential to know the nuances of these two forms of diabetes and how they impact people's lives. In this video, we will explore the distinctions between type 1 and type 2 diabetes, examining their causes, treatments, and implications for those living with these conditions. We will delve into the scientific knowledge behind these differences, but in a way that's accessible to everyone. And before we proceed, remember to subscribe to our channel for more informative content on health and well-being. Differences between type 1 and type 2 diabetes. Cause. The first aspect that distinguishes type 1 diabetes from type 2 is related to the underlying cause of each condition. Type 1 diabetes. Type 1 diabetes is an autoimmune disease in which the body's immune system mistakenly attacks the beta cells of the pancreas, responsible for insulin production. The exact cause of this autoimmune attack is not fully understood, but genetic and environmental factors play a crucial role. This assault on the body's own blood sugar regulation system leads to a lack of insulin production. In other words, people with type 1 diabetes either don't produce insulin or produce very small amounts. Type 2 diabetes. On the other hand, type 2 diabetes is more linked to lifestyle and genetic factors. While genetics play a role in susceptibility to the condition, obesity, lack of physical activity, and an unhealthy diet are significant risk factors. In type 2 diabetes, the body initially continues to produce insulin, but the cells become resistant to it, meaning they don't respond properly to the hormone. Over time, the pancreas's ability to produce insulin may decrease, worsening the condition. These fundamental differences in the cause of type 1 and type 2 diabetes have significant implications for the treatment and management of the disease. We will continue to explore these differences in the upcoming segments of this video. Treatment. Another fundamental aspect in differentiating between type 1 and type 2 diabetes is the treatment approach to manage these conditions. Type 1 diabetes. The treatment of type 1 diabetes involves regular insulin administration. Since people with type 1 diabetes don't produce insulin or produce minimal amounts, insulin administration is essential to regulate blood sugar levels. This can be done through insulin injections or via an insulin pump that releases controlled doses throughout the day. Additionally, it's crucial for people with type 1 diabetes to regularly monitor their blood glucose levels and adjust their insulin dose as needed. Type 2 diabetes. Treatment for type 2 diabetes varies and can include a combination of lifestyle changes, such as adopting a balanced diet and regular physical activity. The goal is to improve insulin sensitivity and control blood glucose levels. In many cases, doctors may also prescribe oral medications to help lower blood sugar levels. In more advanced cases, insulin injections may be required to maintain glycemic control. These differences in treatment reflect the underlying causes of the conditions. In type 1 diabetes, insulin administration is essential due to the complete lack of insulin production, while in type 2 diabetes, treatment focuses on improving cell response to insulin and, in advanced stages, supplementing with insulin. Understanding these distinctions is crucial to ensure proper diabetes management and the well-being of those affected. Implications for those affected. Now that we've examined the differences in the causes and treatment of type 1 and type 2 diabetes, it's important to consider the broader implications of these conditions in the lives of those affected. Type 1 diabetes. For those with type 1 diabetes, the ongoing need for insulin administration is an essential part of life. Regular monitoring of blood glucose levels and adjusting insulin doses are daily practices. The absence of endogenous insulin makes strict control of blood sugar levels crucial to avoid long-term complications such as organ damage and circulatory problems. Additionally, people with type 1 diabetes often face emotional and social challenges due to the stigma and stress associated with constant condition management. Type 2 diabetes. For those with type 2 diabetes, management often involves a lifestyle change, including a healthier diet and regular exercise. These changes can be highly effective in improving glycemic control. However, type 2 diabetes is a chronic condition that requires continuous monitoring, as the progression of the disease can lead to the need for medication or insulin over time. Additionally, type 2 diabetes is also associated with long-term complications such as heart disease, kidney damage, and eye problems. In this context, it's essential to highlight that, regardless of the type of diabetes, medical support, education, and follow-up are vital to ensure good management and minimize complications. Many people with type 1 and type 2 diabetes can lead healthy and productive lives with proper treatment and maintaining a healthy lifestyle. Throughout this video, you can access important information about the differences between types of diabetes. This knowledge is essential to minimize the risks and complications associated with diabetes, so make good use of all this information and take good care of yourself and your family. Don't forget to subscribe to our channel to stay updated with our informative content on health and well-being.